Hello everyone, welcome to the episode number 2 of Women Diaries. Today we are going to discuss about menstruation. Menstruation means shedding of the lining of the uterus and the remnants of the unfertilized egg. So, commonly it is known as having your periods. When you are menstruating, it is said that you have your periods. What exactly happens is that blood and other waste tissue from the uterus comes out of your body through your vagina. Each month, from puberty to menopause, a woman's body undergoes a number of changes to get it ready for a possible pregnancy. All these changes are hormone driven, and this entire process is known as menstrual cycle. During each menstrual cycle, an egg develops and is released from the ovary. The uterine lining builds up and prepares itself for a possible pregnancy. But if there is no pregnancy, the uterine lining sheds and the cycle starts again. Now let us understand the phases of menstrual cycle. There are four phases of menstrual cycle: the menstrual phase, the follicular phase, the ovulation phase, and the luteal phase. The first phase of the menstrual cycle is the menstrual phase. This usually occurs for 3 to 7 days. In this, there occurs bleeding. So, what actually happens here is developed egg which has been released from the ovary to the uterus is not fertilized. Hence, there is no pregnancy. So, the uterus that has prepared itself by thickening the lining of the uterine walls is of no use. So, the egg, along with the lining of the uterus and other waste tissues, is released from your body through the vagina in the form of blood. During this phase, that means during the menstrual phase of the menstrual cycle, you may experience abdominal cramps, headache, tiredness, leg cramps, tenderness of the breast, heaviness of the breast, painful breast, low back pain, mood swings, irritability, and various other symptoms. Second phase of the menstrual cycle is the follicular phase. This phase begins from the very first day of your menstruation and ends when you ovulate. What happens in this phase? So, eggs get developed in the ovary, but only the healthiest egg survives. And the uterus prepares itself by making its lining thick for a possible pregnancy. Ovulatory phase is the third phase of the menstrual cycle. In this phase, the mature egg is released from the ovary. It travels through the fallopian tube and reaches the uterus to become fertile. This usually happens on the 14th day of the cycle, but on an average, it may occur between 10th to 16th day. And the last phase of the menstrual cycle is the luteal phase. In this phase, if the pregnancy has occurred, there is release of human chorionic gonadotropin hormone. But if pregnancy has not occurred, you will experience symptoms of premenstrual syndrome. With this, we end the discussion about menstruation. I hope all you little girls have understood what I've tried to explain. Be careful and stay safe. Thank you.